This is actually an old topic in the social sciences. It was first described actually in 1858 by a guy by the name of Farr. There was some previous work in the 18th century, in the mid-1700s, by a mathematician actually, which was questioning how good is it, because in those days they thought that monks and nuns lived longer, and that it was a holy state to not be connected to other people, to be solitary. And then the mathematicians began to do some work, and they said, actually, it looks like the nuns and the monks didn't live longer. In fact, they lived less long. And so then people began to wonder, well, is it actually the case that the marital state, being married to someone, prolongs your life? And so then this statistician, mathematician, did some work far in the mid-1850s, and he looked at a whole country's worth of data, and he found, in fact, that widows die at higher rates than married people. Very early on, the mathematicians who were studying this effect, or this phenomenon, said, well, there are a couple of possibilities here. Either being married makes you healthy, or being healthy makes you married. So the only people that are unable to get married are the unhealthy or poor ones, and so being unmarried is a marker for those traits, and that's what's killing you, not that being married is improving your health. So this is the difference between a causal effect and homophily. So maybe it's the tendency of the well to become married, not of the married to become well. So very early on, people identified this effect, and somewhere in the next century, people added an additional effect. They said, well, maybe the reason when you die, your wife's risk of death goes up is that you're both hit by lightning at the same time, and your wife just dies a few seconds after you, or you're both struck ill in some other way. And this is, of course, the problem of confounding some other factor that makes you both die at once. One day I had this experience which I talk about a lot, which is that I was caring for a woman who was dying of dementia, and she was being cared for not by her husband, but rather by her daughter. And one day I went to visit them, and the daughter was exhausted from caring for her mother, and the daughter's husband had become sick as a result of his wife's exhaustion. And after I left the home that day, I was driving home, my phone rings, and it was the husband's best friend that was calling me, because he was worried about his friend. So here we had a situation in which the illness in one person spreads from the mother to the daughter, from the daughter to her husband, and from the husband to the friend. And so I suddenly had two very simple observations. First, that the widowhood effect wasn't restricted to husbands and wives. It could involve other sorts of pairs of individuals. And second, that it wasn't even restricted to pairs of individuals. It could spread, across these tetrads, from one to the other and so forth. And that, combined with the work I was reading that was being done by these other social scientists and by these physicists, I suddenly realized that what I had been studying, these husbands and wives, were a special case of social networks. They were a dyad, right? The simplest kind of network you could have. And so, and I suddenly realized that I could study and understand much broader effects, that I could, if I could, collect data, we could study social network effects and the spreading processes within networks as relates to health much better. And then around 2001, I moved to Harvard University, and very soon thereafter I met James Fowler, who's become my closest friend and one of my closest friends, and with whom I've done most of the work on social networks. He's a political scientist and now also professor of medical genetics at UCSD. And James and I have been working together pretty much since then. And we began, as you know, to do a bunch of papers looking at spreading processes on networks, and then eventually other work as well. That obesity was epidemic in one meaning of the word, which is that there's more of it than there used to be before. So, we've gone from like 10% of Americans being obese to 20% of Americans being obese just in the last 10 years. Like from 20% of Americans to 30% being obese just in the last 10 years. And now about 2/3 of Americans are obese or overweight. So it's clear that obesity was epidemic in that sense of the word. There's a lot more of it. But we also wondered whether we could find evidence for obesity being epidemic in another meaning of the word. Could we see a kind of contagion in the network? Could we find evidence that obesity was literally epidemic, not just metaphorically epidemic? And so we wanted to see whether we could trace out cascades of weight gain in the network. So I gain weight, then you gain weight, the next guy gains weight, and it spreads. And so the first thing we did is we mapped these networks And we found clusters of obesity within the network. So individuals, there was like these little outbreaks of obesity clustered within the network in particular topological niches within the network. And that finding, while interesting, is compatible with a number of explanations. One possibility is that people are affecting each other. Another possibility, which would be a kind of induction or a causal effect, a kind of spreading process. Another possibility is that there's just homophily or love of like, or birds of a feather flock together. So maybe it's not that obese individuals, not my weight gain causes your weight gain, maybe we form a tie because we have a similar body size, for example. Like the William Farr example. So it's not that my health is causing my wife's health or that my death is causing my wife's death. Maybe it's that my wife and I got married because we had a similar health traits. Okay? And the third possibility is that some other factor is making both of us gain or lose weight at the same time. We both live near a fast food restaurant, for example. Now, typically, all three of these are present in any social process, and the challenge when you're using observational data is to find statistical techniques that help you have confidence to what extent each of those is going on. So we used a variety of statistical methods. We also proposed some new ideas, this asymmetry test that we suggested, that helped us, and we had a bunch of evidence that to us was very consistent with not only the existence of homophily and confounding, but also interpersonal influence. So these clusters that existed within the network could not easily be explained merely by the operation of homophily or confounding. They also reflected the operation of induction or spreading process. Some people, homophily is the thing that's of interest. Why are the good students preferentially forming relationships with other good students? And in that situation, it's a nuisance that one student's study habits might affect another student's study habits. You want to get rid of that to estimate what's the probability. Or for someone else, they're interested not in any of those phenomena, they're interested in marketing effects. So they're interested, how can we get groups of people to behave in a certain way? We want to broadcast into a network and get a group of people to behave some way. It's annoying when people who are likely to respond to our message are forming ties to each other. We need to get control for that and get rid of that effect. So each of those things can be a focus of inquiry. And the challenge, again, as I said, is to try to use methods that allow you to have confidence. And of course, ideally, and eventually, James and I started to do experiments as well, where we experimentally created networks of interaction, and we manipulated the interactions in certain ways we can discuss later if you're interested. So there have been a number of papers, a much larger number, it's true, a much larger number of papers that have been supportive of our work, either have confirmed our findings, sometimes even the magnitude of our findings, and also papers that have sort of argued that these statistical methods we use, that there aren't any better methods that can be used. There's a class of models that one could use called Siena models. The problem with Siena models, although we like those models, is that they don't really scale. You can only really reliably use them with smaller networks of 200 or 300 people. And plus, the Siena models, because you're always working with observational data, they involve certain statistical assumptions which are very similar to the assumptions that we've used. So they don't actually solve any of the main problems. Some of our critics have said to us, well, look, there's homophily could explain these results. It's very difficult to respond to criticisms without appearing defensive. And James and I are glad that our work is getting attention. And we also recognize this is the way science advances. And we're open to any suggestions about how to do the work in a different way. But no one has yet suggested a superior way of analyzing the data. So part of our concern with some of the critics is that they seem to be suggesting that because statistical models involve assumptions, that we should just give up and go home. And to me, that's a very nihilistic conclusion, and it would be akin to suggesting that we should stop observing the heavens with normal telescopes because we can imagine the existence of a space-based telescope. That because the atmosphere interferes with our observations of the heavens, and we have to make there's some flaws in these measurements that we shouldn't even bother. And that's a bit of an extreme example, but that's sort of how I feel about it. I feel like we have the tools that we have. They allow us to observe the world with certain limitations. We've tried to be very open about the assumptions and limitations. Now, what are some of the assumptions and limitations? Some people feel that we haven't been able to adequately adjust for homophily. And I don't think that's the case, actually. And there's been a bunch of modeling work that's been done since then that shows that the kind of statistical models that we used actually do adequately allow for you to make inferences about the amount of induction present, even if those same models don't allow you to estimate the amount of homophily. Since we're not interested in homophily in this application, all we care about is that the models adequately adjust for homophily. Those models are good for us. First point. Second point, it's annoying when people say to you, look, there are these other explanations which you yourself are aware of. I mean, in all of our papers, we describe these phenomena. So I don't think the critics should get much credit for pointing out stuff that we discussed ourselves. You know, it's not like, you know. And then a lot of the criticisms also apply to all statistical models. So some of the critics' points have to do with certain assumptions that are deeply buried in regression models. And these same, if we take those criticisms seriously, we would basically abandon all observational statistical inference in any field. In the social sciences, in geology, where you can't really do experiments very much, in astronomy, you know, in any field where you observe the world and you use statistical models, some of the critics' criticisms are so general that they apply, you know, we would have to stop observing the world, at least with statistical models. So, you know, I think that, and then some of the criticisms I think have been helpful because, for instance, there was one paper that one of our ideas had to do with this asymmetry test. So if I say you are my friend, you could reciprocate the nomination. You could say I'm your friend. We're going to call that a mutual friendship. Or I could say you are my friend, and you could have no idea who I am, which I like to say is my experience in high school. I thought all these people were my friends, and they had no idea who I was. We're going to call that an ego-nominated friendship. And the last possibility is that you say I am your friend, but I don't know who you are. We're going to call that an alter-nominated friendship. So I'm the ego, you're the alter. 3 kinds of friendships. Now, based on social theory, we would expect that if we're going to imagine that you are affecting me, that there's interpersonal influence, we would imagine that influence should be largest in the mutual friendship. You and I are close friends. I say you're my friend, you reciprocate. There should be a lot of interpersonal influence there. Second, we would say that in an ego-nominated friendship, there should be an effect. I say you are my friend, so when you do something, I pay attention to it. I copy you. I model you. And third, if at all, an alter-nominated friendship. Here, you say I'm your friend, but I may not know who you are. You're gaining weight, but I'm completely unaware of it. I'm not paying any attention to you. So we should see a gradation in effect. If we see that gradation in effect, it helps exclude the possibility of the nearby fast food restaurant making us both gain weight, because the fast food restaurant doesn't care if I nominate you or you nominate me, right? So we propose this idea that if the influence flows along the vector, it's more consistent with a causal effect than with an effect due to confounding. So since then, some other critics have pointed out certain additional assumptions that are buried in this little story I just told you. And those assumptions are nice to know about, but they don't fundamentally subvert this idea. And in fact, even in those critics' own hands, they have to really twist the assumptions to get very implausible situations which would nullify this test. And there's been other work done by computer scientists which have also supported this idea. So anyway, so it's been interesting. I would have to say that part of what's motivated James and me to also begin to do experiments has been the appeal of having more robust causal inference when you do experiments. But the problem with experiments is that what you gain in the ability to do causal inference, you lose in verisimilitude. So experiments are very thinned out versions of reality. Right? You isolate everything but one little parameter, and in these conditions, in these subjects, in this situation, with this outcome, you observe something. But critics could then say, well, that's not real. You know, like if you randomly assign people, as we have, to different kinds of experimental conditions, people would say, well, that's not how the real world works. So basically, science advances through a combination of observation and experimentation, and to the extent possible, James and I have been trying to, you know, work in that tradition.
Time never really on my side. is only shadows in my mind.